Welcome to another episode of the Face Podcast. Today, I have the honor of interviewing Dr. Jason Diamond, a board-certified facial plastic surgeon based here in Beverly Hills, California. He is well known for his signature procedures, the Diamond Facial Rejuvenation, the Insta Facial, and the Metacine Minster Facial. He also has a skincare line, which has been 6 years in the making, called Metacine. His focus has always been on artistry, excellence, and I'm very happy to be interviewing Dr. Jason Diamond. You're really going full steam ahead with your brand.
Yeah, I mean,
tell me about it.
Yeah, so it's called Dr. Diamond's Metacine, Metacine.
Yeah,
right?
very cool.
Which is an ode to like the future with meta, but also it's science and medical backed, so medicine. But it's we started with what we call the Instafacial collection. Those are our two SKUs that we have right now, and that's based on the in-office Instafacial procedure that I developed, 10 years ago, which is an in-office medical based skin treatment protocol that involves taking your blood, injecting it, using a combination of lasers, using medical grade collagen, needling the blood in. So the system in which we've created, we called the Instafacial, which we've trademarked that name, and based on the Instafacial, it's become a Hollywood favorite over the years. It's developed its own cult-like following worldwide. I mean, I have people literally fly me to the Middle East just to do that. When we talk about what do I do in the Middle East, a lot of it is like that. Even though I do 12-hour surgeries and people come from all over the world for that, they equally are interested in the Instafacial. So because this in-office treatment was so effective using bioregenerative properties and principles, that's why I said, I was like, I have to develop. I've been using it for years. Bioregenerative techniques in surgery. I've been using nanofat and exosomes and PRP. We've been using this stuff for years. We were like the early adopters, early adopters and pioneers of it. So I had the know-how to put it in a bottle, essentially, to create a formula that would work. And so that's how we came up with this brand. And so we're starting with the Instafacial collection, which is to mimic the in-office Instafacial, and we're developing products along that line from there. So that's where we're at. And it's people love it. I love it. It's something that truly effectively works, which is hard to find really things on shelves that are actually bioregenerative that work, but this does. And that's where we're at.
So you have a massive celebrity following and a massive celebrity clientele. There's so many names I wouldn't even bother to start going into it. But for those following along at home, just walk us through exactly what an Instafacial is. So everyone wants to know.
So I'll back up just a little bit and tell you. So when I was learning, I came out to LA to learn because clearly, I think it's not really debatable. The most accomplished surgeons in the world are right here in this small area. We could throw a rock and hit 100 of the world's most famous surgeons right from this location right here. And it's always been that way. Yeah. It's always been that way. So I came out here to learn from the best. And so when I wanted to learn nose jobs, for example, I found out the top 5 nose specialists in the world and studied with them. Facelifts, I went to the top 5 facelift specialists and learned facelifts. Facial implants, I did the same thing. Fat injections, I did the same thing. Well, I really wanted to learn a little bit more about skin because plastic surgeons typically know a very basic understanding of skin. Very basic. But I wanted, I was learning all the world's most technologically advanced techniques and all the secrets from the world's best with the deeper structures, but I'm like, something that I need to really get a competitive advantage. I need to learn more about skin. So I spent some time with some of the top dermatologists in town. And it wasn't long before I realized, wow, we're really, as a plastic surgeon, you're really not really understanding the depths of what there is to understand about skin. So I took a very early interest in it and realized how important it was to my facial surgery results. And that's why I became a very early adopter of skin techniques while I was doing my facelifts. And again, I was introduced early to the bioregenerative nature of like using stem cells, what we call nanofat, using exosomes, using PRP, all these things that they're what we call biomimetic bioregenerative. It's introducing things to teach your body how to repair itself, which the body wants to do. And when we're young, the body knows how to do it. It's why kids heal so well. Kids get cuts, they don't even scar because the healing is so effective and efficient. as we get older, we lose that.
Mm-hmm.
And I realized early on how important adding that component to my surgeries was. And early on, they always say it takes gray hair to develop a facial plastic surgery result. You don't develop a facelift practice till you have gray hair. Well, I was like 32 and had this big facelift practice because my results were so good for a lot of different reasons, but my attention to the skin was a big component of that as well. And so over time, I said, we can take advantage of these bioregenerative principles in the office. I don't have to necessarily put people to sleep and do a 10-hour facelift on them at the same time. I can figure out a way to do it in the office with minimal sort of downtime and in a very easy way. And over time, we developed this procedure called the insta facial. And it was more a passion project than anything else. I wasn't doing it for any particular reason, just that other than I knew I could do it. So we were playing around with different concentrations of plasma, PRP, playing around with different combinations of lasering to make the PRP most effective, playing around with certain depths of needling and different concentrations of medical grade micronized collagen to like make it all blend in. And we came up over the years with our combination that is extremely effective and developed its own, like I said, its own like cult-like following really rapidly. And we call that the instafacial. So that's what the instafacial is. So somebody will come in, we'll determine their skin type, what we need to do for them, but it will involve a combination of lasering. It'll involve taking their blood, injecting that strategically, laying it on their skin, needling it in, and then using collagen, using medical grade collagen. So that combination of procedures is what the instafacial is.
And are you then using fillers as well?
I will certainly do facial sculpting at the same time. I'll do, this can be done standalone or can be done at the same time as many other procedures. And I will even do an instafacial when people are asleep doing surgeries. But oftentimes, if they're already asleep, then we have their fat. We'll just take the nano fat, which is, you liposuction out the fat. You take the essentially stem cell component of their own fat. But the instafacial works in the office just about as effectively without having to liposuction fat out. But if we're already asleep, then we take their fat and we do it that way.
If the patient has an element of pigmentation, can you correct that as well?
Yeah, so it depends whether if someone's got pigmentation, it depends where their pigmentation is from, but oftentimes this is as effective as anything else out there. Sometimes pigment can be very tricky and I'll never tell anybody one treatment we're going to get rid of it, but we always can make progress and oftentimes completely eliminate it. It just depends on what the etiology is.
So skin is definitely in. There's been such a resurgence of, bioremodeling and, even in Australia, skin boosters and now we've got these polynucleotides. But first and foremost, you actually are a board certified, very famous facial aesthetic plastic surgeon. So when is the right time for surgery?
Well, that's a great question. When is the right time for surgery? So, right. As you know, I am a facial plastic surgeon. Like you just said, I built my career and my reputation based on my facial surgery results. That's how I built my name. Before I even did a filler in somebody's face, I built my name on my facial surgeries. And it was based on that, it was based on that reputation, the success of the practice, that I then developed. I said, similar to the instafacial, where I knew I had the know-how to create something in the office that would be just so good. I felt the same way about non-surgical things. I'm like, I know the facial anatomy better than anybody. And by the way, I was one of the only surgeons in the world, still am, who customized facial implants. Wow. Meaning if someone needs, depending on their anatomy, for certain implants in the face, which can be the most powerful way to improve somebody's face on the right person, I will customize them. Now, today, we use computerized system. We get a CT scan of your face. We make a 3D model of your face online, and I use a computer system to create the implant shape, size, location exactly to the nanomillimeter that I wanted. Okay, okay. But before we were using computerized systems back in the day, I would actually shape these implants with putty. I would get a replica of the skull based on a CT scan, and I would take like Play-Doh. I would take putty and literally my hands craft these implants and then I would send my putty model to the company, and they would replicate an implant. And I was one of the only people in the world doing this at the time.
That's incredible, because I have had so many patients regretfully say, I wish I hadn't had the implant because it's not right for my face. It feels clunky. It's too wide. It's masculinized me.
Totally. And to assume that the same implant's going to work on me and work on you, which is most 99.9% of surgeons out there who use implants, they open one out of a package.
Right.
And they'll put the same one in you, same one in me, same one in her and him. And to think that that's going to, that'd be like saying the same shirt is going to fit on both of us. It just, it doesn't, it's not close to ideal, but a customized implant is perfect, and they are never clunky. We make them delicate and but the point is, I used to craft these implants out of clay, out of putty, and so it just like the insta facial situation, it dawned on me. I was like, I can do in-office injections to recreate exactly what I'm crafting with putty, and just essentially inject an implant in, and that is the procedure that I termed diamond facial sculpting. And so facial sculpting has become a very, very important procedure for us and for the Diamond Face Institute. It's one of the most popular things that we do in an in-office, no downtime type of thing. And it's so effective. And so that's how I came up with, really started my non-surgical practice, because I was like, I started doing this and people were like, oh my God, this is better than any filler I've ever seen. And I knew from day one, people were coming in and all the rage of the time, because fillers were just getting started. This is 2000, this is 1997, 1982. Sure. All the rage was fill the laugh lines, fill the laugh lines, and I was always like, people are barking up the wrong tree. I knew from day one that wasn't right. And I was like, and all the derms and all the people were injecting collagen. We didn't even have hyaluronic acid.
I've injected
collagen in the laugh lines. And I'm like, you guys are wrong. And by the way, what is the name? What is the name of the discipline of fillers? It's called dermal fillers, right? That's wrong. It shouldn't be dermal, right? It shouldn't be dermal. Just the name implies that that is not right. The way people do it is not. And I knew this. So I'm not dermal. I'm periosteal. Like, I am not dermal at all. Dermal is where all the problems happen. And even just the name is wrong. So I came up with this facial sculpting procedure where I was injecting essentially implants. Results were incredible. And that's how I started my non-surgical practice. I used my surgical knowledge and my surgical techniques to really kind of perfect and hone my non-surgical practice. So I developed a non-surgical practice 15 years ago, and that's become a huge part of what I do now. So I do an equal amount of surgery, an equal amount of non-surgery. So when you ask me what is the right age for surgery, the right age for people with big ears is 5 years old.
Yeah, okay.
That's totally acceptable. Sure. 5 years old is the agreed upon appropriate age to. So it's a 5-year-old, right? For noses, and that's, by the way, to have these kids, to help these children avoid psychological problems from being made fun of for having Dumbo ears, right? Because those psychological problems from being made fun of at 5 can have huge impacts the rest of their life. So that's 5-year-old. For noses, it's appropriate. And by the way, the reason is because the ears are fully grown by 5. For noses, for women, for girls, it's 15. For boys, it's 16, because the noses are fully grown at that point. And again, it's to help them avoid psychological impacts from being extremely self-conscious. So when's the right age for surgery? It totally depends. I do surgeries on all ages, and I do non-surgical procedures on all ages. So there's really no right or wrong answer. That was a long roundabout explanation to your question, but there's really I can't tell you the right age is 30. Like, I can't tell you that. It depends on.
There is a trend in Hollywood, for example, to maybe have facial plastic surgery a little bit earlier.
Well, in the office, we have what's sort of our secret procedure. So we call it the Diamond 40. It means it's many people in their 40s, particularly making a living with a face, who come in for little mini facelifts. And they look good in 8 days, 10 days. Like, you would never even know.
Talk me through that, though. Yeah. Like, what is a mini facelift?
So the term, as a facelift specialist and expert, I can tell you there are a million different names for a facelift. And oftentimes, it's just semantics. What somebody calls a mini facelift is the same as what someone else calls a lower facelift, which is the same as someone else calls a ponytail lift, which is the same as someone else calls a 2-stitch facelift. There's all these different names. The reality is there are several different vectors of pull. There are several different techniques that you can use. So a mini facelift is really just describes how aggressive we're going.
Okay.
When we're going mini, we're going very non-aggressive.
Okay.
We're going very conservative and keeping a very limited dissection, limited to around here, where your hair can even cover it, and you can look good in 5 days because your hair is covering the business end of the work, but it's just enough to tighten that jawline and tighten that neck for people who don't need much, for people who are young and just need to look crisp and sharp kind of perpetually.
Are you addressing the smash?
We are addressing the smash.
Okay.
Always. Any facelift I do
Okay.
addresses the smash.
Okay.
Any facelift I do. I don't do a facelift
Sure.
without addressing the smash. A mini facelift for me might also mean a minimally invasive neck lift. So typically a facelift involves incisions around the ears, but it also involves an incision under here to tighten up the neck. Well, we've helped pioneer a procedure where we don't even need an incision. We use a percutaneous technique where we're just making punctures with a needle. Punctures don't scar, right? You get Botox, you don't scar. Needles don't scar. So we make a bunch of punctures and we crochet a surgical suture through puncture to puncture to puncture to puncture and create like a hammock that sits between the skin and the muscle, and it kind of elevates and cinches up the muscle to kind of pull it up underneath the jawline. So I'll oftentimes do, and that in and of itself heals in like 5 days. Like there's almost no downtime with it. And that's a very common procedure amongst celebrities too, who just like, I need a quick little.
And how long would that last?
5-10 years, depending on the
wow.
person.
Okay.
Yeah. This is not a thread lift
No,
that
that's what
lasts a week.
I want to actually make that very clear because people are there is a misconception that a thread lift will give you that result.
No.
It's not possible.
Not possible.
Not
We can
possible.
talk for an hour about thread lifts too. We'll get back to that.
Yeah, sure. I'd love
This
to.
is not that.
Great.
So for me, a mini facelift often means a very conservative dissection here and a minimally invasive neck lift. So we're getting this, just sharpening that up. They literally can be on camera in 10 days. I don't recommend 10 days, but we had many people go back in 10 days. Although it always makes me a little nervous because you never know, a bruise can stick around for 6 weeks. Depending, you bump your arm, you can have a bruise for 6 weeks, but literally the healing is very fast with that. That would be my version of a mini facelift. This is a sort of a modified deep plane facelift.
Sure.
That's a buzz term, deep plane facelift.
Yes, it is.
Okay. Now, a more extensive facelift would oftentimes mean we're just being more aggressive with our dissection. We're being more aggressive with the amount of tissue we're moving around to tighten things more.
Sure.
That would be a more standard facelift.
And much more downtime.
And much more downtime.
Yes.
The longer the face,
Swelling.
the longer you do, the more downtime. It's just the way it is. Okay. So when you ask what a mini facelift is, it's semantics, and for everybody it's different. But for me, that's what it means: a conservative elevation here, minimally invasive neck lift here, really very little downtime, and very nice sharpening to the neck and jawline. Now, for somebody who's got heavy jowls and lines around here, lines around the mouth, the battle is not won with a mini facelift. The battle's not, my saying is, the battle around the mouth is not won around the ears.
Okay.
To win the battle around the mouth, you have to get out near the mouth, and that becomes a more aggressive facelift, and it really becomes a vertical facelift, not a deep plane facelift. So we could talk about deep plane facelift. So my thing about this, it always makes all this stuff makes me laugh. There's so many things that make me laugh.
There are so many.
There's so many things, but here's the thing that makes me laugh about this. So the very first facelift I ever learned was the deep plane facelift, and I learned it from the guy who made it famous. The deep plane facelift was really described by a guy in Texas named Sam Hamra. He's the one who came up with this thing called composite facelift. And it was essentially like limited skin work, real aggressive smash work in a certain way. Okay. He taught that to the most famous facelift surgeon in the world, who was right here, named Frank Kamer. And I studied with Frank Kamer. Frank went and learned this from Sam Hamra, brought it back to LA, and called it his version of the deep plane facelift. And I learned it from Frank Kamer in 1998. Kamer was the most famous facelift surgeon. That's who, before I even lived in LA, it's who I wanted to be. I wanted my practice to be Frank Kamer's practice. I wanted to get that practice. That's what I was striving for my whole career when I was getting started. And I studied with all the famous facelift surgeons. Frank Kamer was the best. His techniques were the best. His patients were the highest level, and he just was the best. And so I mimicked Frank Kamer, and this was the deep plane facelift. This is before people even knew what that meant. Absolutely. We're talking 1998, 2000. So there were other famous facelift surgeons out here. There was Steve Hoffland, who did Michael Jackson and Joan Rivers and all these big famous people at the time, and he wasn't doing a deep plane facelift. I studied with Hoffland too. There was Norm Leaf, who was very famous. He wasn't doing deep plane facelift. There were all these famous but Kamer was the one who was doing the deep plane. Okay. So when I started my practice, the first hour of every consultation would be me describing why we should be doing a deep plane facelift and why it's the best. And people are like, what does that mean? You know, I've heard about this, and they call it the, I heard about the SMOS. Is that a SMOS? I'd be like, well, it is. Okay. So after about 10 years of the whole consultation, me explaining the differences between the deep plane facelift and the other types of facelift, I finally developed my reputation where people stopped even asking. They just come in, whatever you think, doc, boom. And I didn't have to even go into it anymore. So I stopped talking about it like 2010. I think I stopped mentioning it. Then all of a sudden in like 2000, like 10 years passed. Then in like 2020, all of a sudden I started hearing the term deep plane facelift. I think I heard it on social media and people started asking about it.
Everywhere.
Now, I don't think I see a patient come in for a facelift who asked me if we're going to do a deep plane facelift, as if it's some new thing. And it just makes me laugh that, you know, the power of marketing and social media. And, you know, there are these younger surgeons who are skilled marketers, they're tech experts, they're computer experts, and they know how to make these terms go viral. So somewhere along the last 4 years, deep plane facelift went viral as if it's some new technique. This thing's been around for 30 years or more, and it's how I started my career. The reality is, I'd say it's appropriate for probably 40 to 50% of my patients. Like 60% of my patients need vertical facelifts. For the older population with this, deep plane facelift doesn't touch it. Okay. It doesn't touch it. You have to do a vertical for that. So when we talk about the deep plane facelift, it's been around for a long time. It's nothing new, but it's been marketed heavily recently, and it's, I guess, sounds like a sexy term now. It does.
It does. There's been so many more celebrities and influencers, you know, online sharing very, very openly their transformations, their journey with weight loss drugs, and then, you know, facelift surgery even. How has that been for you in your practice? Have you seen an increase in, because there's so much information now available to us. Do you have more inquiries than ever?
You know, I've always had a lot of inquiries, always. And before Ozempic, it was the gastric bypass patients. I mean, I've always seen massive weight loss patients, always. But yeah, you probably see more of those now with Ozempic and Mounjaro. We definitely see more. I'd say we see more massive weight loss patients than we used to. But I've always seen them. I've always seen them. So yeah, certainly people lose their weight, and then more often than not, they'll notice sagging to the facial skin. But and people always ask what I do. I always tell them it's much easier to fix that than to make a heavy face look better. It's much easier to it's much cosmetic. First of all, it's healthier for you to get down to the weight you want to get to. Absolutely. Now, I'm not telling you to use those medications, but if whatever you need to do to get down to that weight, that's between you and your internist. But certainly being the right weight is very important, more important than anything else for your overall longevity and health. Absolutely. And we'll deal with the sagging face layer. It's an easy thing to deal with. It's a really easy thing to deal with. There are some implications with some of these medications. We do see a loss of muscle mass, and the SMAS, guess what? That's tied into all the facial muscles, and I have seen that get very thin from these medications as well, and that makes the facelift a little dicier. There's a lot of other things you have to do, because when you're tightening on the SMAS, it'd be, you know, it's like trying to pull your socks up and the sock being all torn and ratty. Like, it's not going to have much hold, right? Well, a thinned out SMAS can have that same sort of feeling, and Ozempic and Mounjaro, they can cause these things. So it's important to, you know, just have patients understand that. But there are things, it just makes if we have to adjust the facelift significantly, do some other things in those situations. I've seen some pretty significant attenuation or thinning of the SMAS layer in those people. Yeah.
Do you find, how are you treating menopausal women? Because there's huge changes in the skin for women as they're reaching that age and moving into menopause. What's your recommendation at that age group?
Well, as far as like hormonal replacement, there are hormone replacement doctors who are great in town, and I refer to those docs. So it's important for women to, you know, have that dialed in. But no matter what, you're going to lose facial volume. Your skin is going to dry. There's things that are going to occur, and oftentimes surgery is the best option for that. And oftentimes it's the procedures we're talking about. Oftentimes it'll be replacing volume, whether we use fat injections or oftentimes customized implants, which are ideal for many people. As at the same time as tightening up the SMAS and removing extra skin and doing some skin some skin treatments for them. So it's a 360-degree answer. There's no one answer for that, but definitely people see some rapid aging during that time.
With the fat transfer to the face, how much do you retain?
That's so. To answer, there's no one answer for how much do you retain from a fat transfer. And fat transfer is probably the most popular procedure, the most common procedure I've done in my career, because I do it with almost every facelift. And I used to take people to surgery just for fat transfers. I don't do that anymore.
Okay.
But I used to when I was, because again, I learned it from the world's best. 25 years ago, I learned fat transfer from the fat transfer world famous experts. And I was like, oh my God. And it was like, fat transfer, this is the answer, this is the answer, this is the answer. And I sort of bought that line and took everybody back for fat transfers. And I quickly realized that it wasn't all that it was cracked up to be. And the reason is, to get a real dramatic result with it, you kind of have to do a lot. And the problem is, sometimes that goes away and sometimes it doesn't. And if it doesn't, you kind of don't really have many good options, and you can be left with these full faces. I realized this within a couple of years. We're talking 20. So I then changed my tune and said, okay, well, we'll do some fat transfers, but I changed my philosophy early on, and my philosophy came, I'm going to make it look great on the table. I'm going to make it look perfect on the table, and not a millimeter more than that. Because if you're someone who doesn't go away on, now we're stuck.
Yeah.
So you can get really nice results right at the time, but yeah, some's going to go away. How much depends on the person. Some's going to stay, some's going to go away. We don't know how much. And back in the day, people used to say, oh, 80% stays. I've seen a million different answers to that question. And the reality is, nobody can say for sure. Some's going to stay, some's going to go away. It's all we know. And so I will never put somebody at risk by overdoing anything. I'll make it look perfect. And you know what? If some goes away, we can go back later, do a little bit more. I'm never going to have you look weird and never give you a permanent problem from having something that's overfold and looks like a chipmunk face. It's just not appealing. It's not the way to go. So given all this, as I was learning all this and as I was developing the non-surgical side, I can tell you right now, unequivocally, hands down, I can give you better results with in-office diamond facial sculpting and some of the non-surgical techniques in the office. I can make you look better and give you a better result than fat injections can. And guess what? There's no anesthesia, and you look good for dinner that night. Okay? And it's extraordinarily predictable. I can tell you exactly how long it's going to last. I can tell you for sure, this part of it's going to last 12 months. This part's going to last 6 months. We know exactly what you're getting. Unlike fat, where it's like, well, yeah, some's probably going to stay.
Sure.
Some's probably going to go away. If it goes away, you'll look great while it's there, but it's probably going to go away. And then, if it does, we can go back and do more, or we can do in-office procedures. So as my thinking changed on this, I will rarely take somebody back just for fat injections. Now, I used to do it all the time. I don't really do it anymore. And so, but given my history of having done all that and doing it every day of the week with facial surgeries, it's probably the most common procedure I performed. And all I can say is, we just have to see how well it lasts on you.
You're really well known and passionate about natural looking results. And we've seen this massive pendulum swing of really extreme overdone faces and bodies for quite some time. Are you really seeing now the shift back to natural?
So I think that the pervasive thought now is that natural is better. My practice has always been one of natural results, always. That's those are the people who come to see me who want natural results. Every now and then you get somebody who's known for their exaggerated look and wants to be super exaggerated. That's never been my niche. It's never been my expertise. It's never been who comes to see me. So it's not like I can tell you, yeah, my practice has dramatically changed. My practice is, I developed my reputation based on natural. I've seen it coined I've seen the term king of natural a million times. I think it's a funny term, but I've seen that for years. So that's what my practice is and always has been. So I can't tell you my practice has changed, but I do hear out there that people are starting to dial it back a little bit and what they're looking for. And I think that is probably becoming more popular worldwide.
Yeah, I've found that too, even in non-surgical treatments. I mean, my practice is very similar. It's always been natural and really maintaining your patient. I mean, your patients age with you. We've had patients in the practice for 13 years now that are still with me, and then they're sending now their daughters in, for a little bit of microneedling and things. So it's really nice to, build that rapport and relationship. And I know that that's a really strong sentiment in your practice, is patient-centered care and looking after your patients.
Totally. Yeah. It's same thing. I've now got 3 generations of people, grandmothers, mothers, and daughters. Like, they grow with you. Right. And again, and look, I've learned over the years, like, they always say, what I always learned is your practice will look like you. That was one of the best pieces of advice I ever got, right? When I started from a mentor of mine. And he said, I joined this guy and his patients, it was his patients and it was his practice. And I was like, this doesn't feel right to me. He said, trust me. He said, be yourself. And your patients are going to look like you ultimately. And that's how you have the most happy practice and the best result. And what does that mean? It doesn't necessarily mean physically look like you, although there's probably a little component of that, but it's just people with the same sensibilities and the same, this similar type of mindsets and philosophies on things. And so, so as I got older, I started and many of my patients were younger. Even though I had a facelift practice, it was like 40s and 50s when I was in my 30s. I wasn't seeing many 70-year-olds I've seen some, but not a whole lot when I was 35. But as I got older, now I'm seeing older patients as well. And you learn how you see people age right in front of your eyes and what's going on and how to address them with more accuracy. So over time I've learned how to deal with all that. And that's one of the main reasons I learned the vertical facelift technique after I had done strictly the deep plane facelift for 15 years, is because it's not very effective for 70-year-olds and people with aging really heavily around here. So, I've changed over the years some techniques for the patients who are aging, that are older population of people. So it's been a fascinating ride and very interesting.
Talking about age, because we're seeing such an increase in, really young girls buying skincare, 9, 10-year-olds having a 10-step routine thanks to TikTok and Instagram. How do you feel about that now you're in the skincare game?
I think it's hilarious. Yeah, my kid's the same way. I make fun of him all the time. I have a 13-year-old. And literally, like in COVID, so we're talking now 4 years ago, he's 13, but when he was 9, I'm not joking, in the 6-month shutdown or whatever it was, I'm not exaggerating when I say I think he took maybe 3 showers. Like, because my wife and I fall asleep at 8 o'clock at night, 9 o'clock, especially in the shutdown. And we'd be like, Jasper, you need to go to bed. And he'd be like, and the next thing you know, of course, he was up till 2 in the morning every night. I think he never showered. I think he brushed his teeth twice during the whole shutdown too. And it was like, he had stuff growing off the back of his ears. It's like, oh my God, dude, and now he's 13. He's got a whole room full of skincare products. He's a skincare expert. He's like, Dad, I laugh about this is true. He's like, Dad, I had this little pimple. He's like, there's no way I'm getting acne. I put a little salicylic acid on it. Then I covered it in niacinamide to close the pores. Then I put a little moisturizer. Like this 13-year-old, I'm like, meanwhile, I'm taking notes. I'm like, did that really? So it's definitely become like, I see it in my own kids, and I think it's really funny and it's interesting how these kids are so interested in wellness now. And I think it's awesome. I think it's great.
My 11-year-old loves a sheet mask. Loves to lie down, just have a sheet mask put on him.
That's really fun.
He has a little relaxing session. Yeah, it's really, really cute.
That's cute.
So, it's changed a lot in your career. What is next for you? How does someone like Dr. Jason Diamond get better?
Yeah, it's a good question. I love what I do. I really love what I do. And every procedure I do, I strive to make it the perfect result. And is there such thing as a perfect result? I guess that's theoretical, but every procedure I do, I try to get the perfect result. And do I learn things along the way? Sure. Yeah, there's little things, little tweaks I make, but I feel like it's kind of like, it's so funny. I'll use this analogy. I've had one before. I just got a Porsche Turbo.
Beautiful.
The little Porsche Turbo, right? And if you understand the differences between a Porsche and other cars, there are louder, more colorful, sexier cars. But the technology behind a Porsche Turbo, it's been the same body style for 80 years. And every year they come in and they just slightly tweak it, slightly perfect it. They've got the world's greatest engineers making just maximizing every little millimeter of that car to make it work perfectly, right? And it's pretty perfect right now. But next year when the new body type comes out, there's not going to be a big rework like maybe some other cars. They've got this thing so perfected and so dialed in, but they'll probably tweak a little tiny thing here that they've tested a million times. Oh yeah, that makes it just... That's kind of how I feel. Like I've got this thing so honed in, but I'm always looking for these little tweaks. There will not be any major, I can just tell you right now, there will be no major like, oh, I'm scrapping this technique and going to something else, because the results are just so proven. But I'm just going to keep maximizing it just the way the engineers will maximize the next generation of a Porsche Turbo. You know what I mean?
I love that.
And so that, and we're working on this skincare. This is this skincare line.
I saw that you're doing moving into the body. I saw one of your videos and the range you're now incorporating into the body. How is that going?
Yeah, it's going great. So listen, this is a passion project. And again, similar to the things in my practice that I do, I only do things that work. I don't do anything that's fluff or BS. And the same goes for the skin line. We're not putting anything out that doesn't work. We worked on this, the first formula we worked on for 6 years before we put out.
Wow.
And we know it works. We've got clinical studies to prove it. I'm not putting out anything that doesn't work. And that's kind of how my practice goes too. And so, yeah, it's been great. And we're excited about that. So that's hopefully a big part of our future.
One of your signature surgical procedures is the diamond facial rejuvenation. Can you just give us a little bit more insight into that for the listeners?
Yeah. So as I was learning my techniques, like I said, I was studying with all the top surgeons in the world. And they were all, I mean, I traveled around, but a lot were right here in Southern California. A lot in Beverly Hills, but some in Orange County and some up north. But still, this is the Mecca. It always has been. And interestingly, I would watch, let's say, Frank Kamer one day, the world's most famous facelift surgeon. Then the next day, I would go watch Steve Hoffman, the second most famous. Or you could debate who. Okay, these guys would be right across the hall from each other, essentially, for 40 years and never once had seen each other operate. Yet they obviously knew each other very well. And this is just an example of two guys. This probably went on with 20, 30 different surgeons, literally, who would be operating right across the hall, 100 feet from each other, and never once had seen each other operate. But there I was watching 20 of them. And I saw all these little things they would do differently, and I was able to kind of pick the best of the best and go and realize, okay, that guy does this great, but that guy does this great, and she does this awesome. And I kind of incorporate it all together. And what I learned quickly was that synergy is king. When you do little things to create the overall result, where the whole is greater than the sum of the parts greater than the whole, whatever that's saying. where it's a synergistic result. Meaning, instead of one big pull, we would do like a little there with one technique and a little there with another technique and just a little there with a different technique, instead of one big technique to do everything.
Sure.
So synergy, that was a common principle I used in my surgical results. I use that principle in my non-surgical results, and we use that principle with our skincare as well.
And the skincare, it's so unique and so cutting edge. And you've explained that it was 6 years in the making. Why is it so unique?
The reason this product, I think my favorite thing about this product is, given our knowledge of biomimetics and growth factors and peptides and all these buzz terms, which again, I've been on the forefront of for over 20 years. Wow. We knew how to use these things, and so the Instafacial collection has over 22 bioactives, and to my knowledge, that's by far and away the most significant amount of bioactives in any product out there. And you might say, well, why didn't you make it 100 or 50? Or, well, why stop? Because the more that you put in, there's competing factors, and these peptides and growth factors, they can deactivate each other and compete.
Sure.
And the research and the development was figuring out how to get the maximum amount in that works synergistically together. And that's what we have. And so could I get another one in there? Well, that's what we were working on and figuring out how to do that so that there's no competition. And it's hard to do, and that's what's taken so long.
And will your body range be addressing like the décolletage and the neck?
Yes, for sure.
Yeah.
Yeah. The Instafacial collection addresses that.
Okay.
But yes, we are in the pipeline. We have things that, are more targeted towards the body, but anywhere there's skin, the Instafacial collection works.
On that note, thank you for joining me on the Face podcast, Dr. Jason Diamond.
My pleasure. Thank you so much.